Good morning. The first item of business is general questions, our shortest question session of the week, colleagues. And at question number 1, I call Michelle Thompson.
To ask the Scottish Government, in light of the demand for neurodevelopmental assessments and treatment for children and adults, what its assessment is of the recommendations by the Royal College of Psychiatrists in Scotland, such as its 4-tiered service model for assessment and intervention.
Minister Marie Todd.
The Scottish Government welcomes the Royal College of Psychiatry's report on meeting the needs of autistic people and people with ADHD in Scotland. We agree with the College that the demand for neurodevelopmental assessment and support now exceeds what Scotland's current mental health infrastructure can deliver, and that different response is needed. We're taking time to consider their report fully, including whether a stepped care model could be considered for neurodevelopmental assessment. We're also driving forward our improvement work, including the establishment of our Children and Young People's Neurodevelopmental Task Force and our ongoing work with National Autism Implementation Team, NATE.
Michelle Thompson.
I thank the Minister for that response, and as the Minister will be aware from my correspondence and indeed our discussions, the rising pressure and demand is an acute issue which is also impacting many individuals in my Falkirk East constituency. And I know the Scottish Government's Director of Mental Health wrote to all the health boards to seek clarification on what assessment and support they currently have in place because of the diversity across different areas. And also the local protocols are different. But I wondered, has there been any findings from these letters that have gone out, and if she's able to give us any further information about what they are?
Minister.
I can confirm that we've now received responses from all of the health boards. We're considering the findings in more detail and what next steps should be taken. The information isn't yet publicly available, so there's no findings to share at this time, but I do absolutely recognise the members' long interest in this area on behalf of her constituents, and I'll ask the Minister, Tom Arthur, to ensure that he shares the findings with her and with broader Parliament when they're available.
Brief supplementary, Pam Duncan-Glancy.
Thank you, Presiding Officer. Parents and adults who are not parents in the Glasgow region are approaching me really worried about access to ADHD assessments for adults. They've been waiting for a long time for any pathway for support, and some of them are struggling to continue with work and other responsibilities. What reassurance can the Minister give that pathways will be available for people in the Glasgow region to access adult ADHD assessments?
Minister.
So I recognise the concern that is caused. Long waits for support are unacceptable, and we're absolutely committed to improving timely access to support, to diagnosis and to support for autistic people and people with ADHD. In July, we announced the reopening of our £2.5 million multi-year Autistic Adult Support Fund. That fund supports third sector organisations which help autistic adults to reach their full potential, supporting them, their families and their carers to understand what neurodivergence means for them and to improve their well-being.
Question number 2, Rachel Hamilton.
Thank you, Presiding Officer. To ask the Scottish Government what legislative action it plans taking in the remainder of this parliamentary session to protect farmers from the threat of rural crime.
Minister Siobhan Brown.
Thank you, Presiding Officer. Rural crime is a serious issue affecting individuals, communities and businesses, and the Scottish Government fully supports efforts to tackle it. The Scottish Partnership Against Rural Crime, SPARC, chaired by Police Scotland, brings together key justice and rural sector partners to provide a robust multi-agency approach to preventing rural crime and support actions taken at a local level. The member will be aware of the legislative programme for the rest of the term and the short time that we have left. There is no plans for rural crime legislation in what remains of this session.
Rachel Hamilton.
I'd like to thank the Minister for her answer. Following a meeting in June, the Minister agreed to write to the Home Office, and the letter highlighted that the Scottish Government missed an opportunity to introduce an LCM in June of 2022, which would have allowed for further safeguards and deterrents to stop rural crime. Since the LCM was missed, rural crime has cost Scottish farmers and rural businesses nearly £5 million, and the letter states that my constituency of Ettrick Rothes, Berwickshire, is a rural crime hotspot. So I want to say also that Police Scotland and the National Crime Unit also wanted to see regulations introduced last summer. So will the Minister, despite her answer, bring forward an expedited bill and work with me to tackle rural crime before the end of this Parliament?
Minister.
Thank you, and I thank the member for her continued interest in equipment theft and serious issue affecting rural businesses. Just for clarity, the LCM and the legislation and that Act has not come into effect yet in England and Wales, as the member is aware and alluded to in her question. I wrote to the UK Government earlier this year regarding the process of the implementation of the Act, and they recently published a summary evidence responses ahead of planned regulations being brought forward. This is an important step towards the Act being into effect in England and Wales. I would reiterate my willingness to work with the member on legislative options, but it would not be in this parliamentary term.
Brief supplementary, Christine Graham.
Thank you very much, Presiding Officer. As the member knows, my constituency is adjacent to hers, and for a former lawyer, I'm not too hot on legislation. It's not always the answer. So can I refer the Minister to the recently published 3-year policy by Police Scotland in collaboration with Sparks, which is focusing on such things as prevention of agricultural machinery using technology, and they've also now 100 specially trained officers. I hope the Minister agrees with me, that might be more effective than legislation. Action, not legislation.
Minister.
Thank you, and I think there's some great work doing there. I know that the 3-year strategy for Spark was published in June, and it's the first time it adopts the 4 Ps model of prevent, pursue, protect and prepare. The refreshed strategy includes a number of actions around how perpetrators will be brought to justice, how rural communities can safeguard against such crimes, and how individuals can be diverted from being involved with them. Part of the work of Spark also involves working with other forces in the UK to disrupt the activity criminals can travel across our border.
Question number 3, Ruth McGuire.
Thank you, Presiding Officer. To ask the Scottish Government when the Children's Scotland Act 2020 will be fully implemented.
Minister.
Thank you, Presiding Officer. While some sections of the Act have already commenced, there are some areas of this wide-ranging Act that are outstanding, but we remain committed to commence. I'm providing updates to the Equalities, Human Rights and Civil Justice Committee on implementation, and I updated them most recently on the 26th of September. 2 SSIs on the regulation of child contact services were approved by the Parliament earlier this month and will be implemented on the 1st of April 2027, and a further set of commencement regulations is planned relating to hearing the child's views, additional factors for the court to consider and delay in contact and resident cases.
Ruth McGuire.
I thank the Minister for that answer. I think Parliament voted for that Act with great hopes that it would centre children in child contact cases and address some real difficulties that we'd heard about. I'm still receiving casework from women where children who have witnessed their father terrorise their mother, both physically and emotionally, are being forced by courts to have contact with their father, despite restraining orders and things being in place. Is the Minister confident that when this legislation is fully enacted, it will address this disaster, or are there more actions that need to be taken to ensure that the judiciary do truly put children's well-being at the heart of decisions they're making around contact?
Minister.
Thank you. Ensuring the child's best interest is central in any contact case, and that was a key aim of the 2020 Act. And I believe implementation will bring big improvements for children in the cases that Ms Maguire referred to. For example, enhancing how their views are heard, ensuring child welfare reporters who can be appointed to the child's views are properly trained, and also in understanding domestic abuse. The regulation of child contact services will help ensure centres are safe, conflict-free places for children, and we are also progressing wider work to improve how the civil and the criminal courts interact, including how the civil courts get information on domestic abuse.
Question number 4, Maggie Chapman.
To ask the Scottish Government what action it is taking to support tenants and owner-occupiers affected by RAAC in the North East Scotland region.
Cabinet Secretary Mary McCallum.
This is a worrying time, Presiding Officer, for those whose homes are affected by RAAC. I have met with residents in Aberdeen, in Dundee, Angus and Clackmannanshire just yesterday to discuss the challenges that they face. We are working with local authorities who are responsible for finding local solutions. For example, I recently agreed to Aberdeen's request for flexibility in an existing housing infrastructure fund commitment. This is allowing the council to provide additional support for residents from within their own budget. I have repeatedly pressed the UK Government for a central dedicated RAAC remediation fund. They have failed to provide that thus far. In the meantime, I'll consider continue considering requests for flexibility in existing budgets.
Maggie Chapman.
Last month, Aberdeen Council told Tory homeowners that they would be offered the full value of their homes before RAAC was discovered, given the £10 million fund made available by the Scottish Government. And yet, for the worst affected city, Dundee, there is still no RAAC fund. Homeowners in Dundee and Angus are wondering why they are still waiting for information and support. When will the Cabinet Secretary announce support for RAAC-affected homeowners who are facing financial ruin in more ways than one in Dundee and Angus?
Cabinet Secretary.
We have to be very clear, Presiding Officer, that the arrangements reached with Aberdeen City Council were very bespoke to Aberdeen. As I said in my initial answer, they were about offering flexibility in honouring an existing housing infrastructure fund that hadn't been drawn down. And indeed, that itself wasn't doable, and we ended up offering flexibility with the Affordable Home Supply Programme, which allowed the Council to create headroom elsewhere. A very specific response to a very Aberdeen-specific case. But as I said in my opening remarks, I will consider requests for flexibility within existing budgets from any council with RAAC-affected residents.
Supplementary, Liam Kerr.
Thank you, Presiding Officer. RAAC homeowners in Aberdeen's Tory who've already sold their homes at an undervalue fear paying tax on the compensation and losing benefits. This would pile yet more injustice on what has been a nightmare for years. Will the Cabinet Secretary instruct officials to help Aberdeen City Council prevent this coming to pass?
Cabinet Secretary.
These are entirely matters for Aberdeen City Council to work through with the residents of Tory, and I would encourage them to do so.
Question number 5, Elena Whittam.
Government whether it will provide an update on the work it has been doing regarding people obtaining in-person GP appointments.
Cabinet Secretary Neil Gray.
Presiding Officer, the latest published data, Public Health Scotland's general practice in hours activity visualisation, shows that as of September, as many as 81% of appointments with GPs and other clinicians in general practice were physical. This is not as high as the proportion pre-pandemic, where approximately 87% of appointments were physical, but we would always have expected the overall proportion of physical appointments to reduce as options for virtual appointments become more available. My predecessor, Humza Yousaf, wrote to GPs in 2022 advising that de-escalation of infection prevention control measures gave them much greater latitude to see patients in person. This, alongside our record funding increase for core GP services and for walk-in clinics, should continue to improve access to one of the critical primary care front doors of our NHS.
Elena Whittam.
I thank the Cabinet Secretary for his answer. In my constituency, access to general practice remains a concern, particularly in rural communities. This does vary between practices, but I am being contacted by constituents about this matter on a regular basis. Does the Cabinet Secretary agree that investment must be matched by concerted, targeted support for recruitment and retention to ensure sustainable care across all parts of Scotland, including in Carrick, Cumnock and Doon Valley?
Cabinet Secretary.
Yes, I do absolutely agree with Elena Whittam. A core element of the record funding increase for general practice is contingent upon increased employment of general practitioners and wider practice staff, and alongside that, through our GP recruitment and retention 20-point action plan, we're taking substantive steps to support practices in rural areas. Our £10,000 Golden Hello scheme incentivises GPs to take up rural positions. The Early Career GP Fellowship is reaching new rural areas thanks to our investment this year, now across 7 health boards. Our graduate entry medical programme, ScotGem, focuses on rural medicine and healthcare improvement, and we continue to fund Rediscover the Joy, supporting rural and island practices with short-term GP cover.
Question 6, Sharon Dowie.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to reduce the number of repeat shoplifting offenders in light of reports that 10 individuals have accumulated over 1,500 charges in the last 4 years.
Minister Siobhan Brown.
Thank you, Presiding Officer. The Scottish Government recognises the harm caused by retail crime, and our budget for 25 to 26 has made an additional £3 million available to help tackle the issue as part of our record investment in policing. Police Scotland has used this funding to establish a retail crime task force which aims to prevent such incidents and pursue those responsible. Police Scotland's plan also includes specific actions to target repeat offenders by using analytical data and intelligence to carry out proactive enforcement activities in areas most heavily impacted. Investment is also being used to develop diversionary programmes aimed at reducing reoffending.
Sharon Dowie.
thank the Minister for that answer. Retailers Against Crime and other industry partners have been clear that intelligence sharing is essential to identify repeat and organised offenders. Given that Police Scotland's Retail Crime Task Force has, in its first 6 months, supported the detection of more than 500 retail offences, will the Minister commit to extending and increasing that funding beyond March 2026 to help tackle prolific shoplifters?
Minister.
Thank you. I know discussions are ongoing with Police Scotland about their budgetary requirements, and I hope the member will appreciate that I will not be making any budgetary announcements in general questions today, but the Cabinet Secretary for Finance has confirmed the Scottish budget will be published on Tuesday the 13th of January 2026.
Question number 7, Alec Rowley.
Presiding Officer, to ask the Scottish Government what action it's taking to address waiting times for gynecological diagnostic procedures in NHS 5.
Minister Jenny Minto.
Thank you, Presiding Officer. This year we've allocated an additional £135.5 million to health boards to tackle the longest waits. This includes an allocation of over £1.1 million to NHS 5 for gynecological support, extra full-day theatre lists and full-day new outpatient clinics. I understand from NHS 5 that they are currently on track to deliver no patient waiting over 52 weeks by our 31st of March 2026 target. Beyond this, we are working with the Centre for Sustainable Delivery to ensure all boards are a sustainable solution for the future.
Alec Rowley.
Presiding Officer, I've been contacted by a constituent, a 23-year-old woman, who has been advised that she may face a wait of over a year for a keyhole surgery that is needed to diagnose the source of an ongoing severe pelvic pain. Over the last year, the constituent has experienced 2 miscarriages, recurrent pelvic infections, as well as the severe pelvic pain significantly impacting on her quality of life. I have raised this directly with NHS 5, but I would be grateful if the Minister would have a look at this case. I'll pass it over, because it's fine to say 52 weeks, but if in the case of this constituent, it really is not acceptable.
Minister.
I thank Alec Rowley for his follow-up question, and he's absolutely right. That length of wait is not sustainable. It's not good for women's health, which is why we have invested the funding. I'm very happy to follow up with him after the questions.
Question number 8, Douglas Ross.
Thank you, Presiding Officer. To ask the Scottish Government whether it will commit to providing full details of why each of the 3,537 or 47% of the total applications to the Future Farming Investment Scheme were deemed ineligible, including whether ministers raised any concerns when presented with this figure.
Minister Jim Fairley.
Presiding Officer, as a matter of routine, the Scottish Government does not provide individual responses to agricultural grant applications to explain why an individual grant application was unsuccessful. A breakdown of the broad category of reasons for the applications which were not taken forward will be published shortly, and I will write to the member concerned to provide the information around that scoring criteria. Scottish ministers were made aware of the scoring criteria, the numbers of successful and unsuccessful applications and the overall value of support offered. But ministers do not routinely become involved in the day-to-day scheme management issues.
Douglas Ross.
I'm sorry, that's just not good enough, Minister. Surely routinely 50% of applications are not deemed ineligible. Something has gone badly wrong here, and it looks like the Minister was asleep at the wheel and didn't even ask any questions. So given the numbers involved here, given that almost 50% were deemed ineligible, and many people are questioning why, is there not a duty on this Government to tell each and every one of them why they were deemed ineligible, what went wrong, and sort it out?
Through the Chair always, Minister.
So, Presiding Officer, the scheme was co-designed with the industry, including the NHS, the National...
Let's hear the Minister.
The scheme was designed with the industry, including the National Farmers Union of Scotland. It was designed to help eligible active farmers and crofters to improve environmental performance of their businesses in terms of climate change biodiversity benefits. Applications were assessed through a standardised framework that cross-checked application data against single application form and other system-held data to ensure consistency, transparency and audit defensibility. The scoring model was looking for core objectives, 6 core objectives: business efficiency, business sustainability, environmental protection, greenhouse gas reduction, climate adaptation and public good. The priority groups that the member talks about, priority status did not alone guarantee funding investments. It also had to demonstrate strong alignment with the scheme objectives and deliver measurable outcomes.